Wa alaikum assalam wa rahmatullahi wa barakatuh, Akhil Kareem. Jazakallah khair for reaching out to me and asking me to listen to this individual's um, message. It was really long, just over 2 hours, subhanAllah. I did listen to the whole thing. I even went back and reviewed some other, other sections of it more than once just to make sure I was like understanding what he was actually saying and making sure I wasn't misunderstanding him. As you know, I don't even know who this person is. This is the first time I even hear about him or ever see him, this Mazin Abdul-Adhim. So, I just base everything that I'm going to be saying now is just based on his, his YouTube post, uh, where he's stating that, understanding depression from the Islamic perspective in depth. Um, so, when I see, first off, when I see a title like that right off the bat, I'm thinking like, who gave you the authority to say this is the Islamic perspective, right? Like it's not even, just be humble and say it's your opinion or, an opinion or my ideas, my thoughts, something like that, right? Like this sounds very kind of, how should I, like kind of this kind of projecting sort of a sense of authority. That's sort of the first thing that kind of caught my eye. Then as I started listening to him, um, and you know me, I try to keep an open mind, listen to everyone as fairly and objectively as possible. Um, and again, right off the bat, he starts talking about, how he has all this, he's done a lot of research and he's talked to psychologists and psychiatrists, and they, you know, quote unquote, generally agree with him, whatever that means. And just sort of like trying again to project this image of, he has some sort of authority in this area because he knows, with all due respect, he's ignorant in this area. Just because you do some research and you talk to some people in this area doesn't make you an expert, doesn't give you, some sort of credibility, like methodologically from a kind of a rigorous scientific perspective. Like, okay, so what? Um, okay, you have information. There's a big difference, ya akhi, between information and knowledge. And we see this all the time. Like you see this all the time, especially with Islamic knowledge. You have lots of people who just have information, but they actually don't have fiqh. They're two separate things. So okay, yeah, sure, you don't need like these fancy degrees and stuff to understand things. Okay, we can agree with that premise. I'm not trying to knock this person down just because he doesn't have a degree or he's a psychiatrist or psychologist. But the reason I'm saying this, and I'm sort of kind of being, kind of aggressive with my stance with this individual, is because what he's saying is actually really dangerous. And you know me, akhi, like I don't get into these, confrontations with with people in general, and I just sort of try to, give people the benefit of the doubt and stuff like that. But this guy is crossing too many lines, and and this is going to be causing harm to Muslims. Like, you know, just to frame things properly, he's talking specifically to a Muslim audience, and is looking specifically at a condition called depression. And right off the bat, he declares his utter ignorance by not even knowing the definition of depression. His definition of depression is, that feeling inside of not feeling good, and he describes it multiple times throughout the his video about, it's this sort of this negative feeling and this sort of like bad feeling inside. And that's not what depression is, man. Like that's absolutely not what the definition of depression is. Like, how is that any different than being stressed or, just not feeling good, or feeling anguish or suffering or distress, or like, he has his operational definition right off the bat is not correct. And hence, if he's starting off with a false definition of what's not actually, like, that's not what actually is agreed upon medically of what that means, and he's using his own definition. Okay, akhi, that's fine, use your own definition, but don't call it, a medical term that's being used to treat people, right? Call it whatever you want to call it. Call it, like, psychological stress, or whatever word you want to use, but coming and saying this is what depression actually is. No, depression is not that. Depression has very clear criteria and guidelines. Depression is classified as a mental illness, and it has, it's a serious biological disorder with obviously significant psychological implications. And I'm going to come and talk a lot about that and sort of get into a lot of the nitty gritty details about some of the differences. But he's, looking at everything he's saying, it's really formulating around this concept of stress and, being, having these negative perceptions and thoughts and all this sort of stuff. And, a lot of it has some truth, but, the reason his message is very dangerous is because he mixes so much falsehood with some truth. And then the normal people who are not experts in this area, how would they be able to differentiate, right? And this is going to cause serious harm. I'm very passionate about this, Yahi, because this causes so much distress and harm to Muslims. And he is a jahil, with all due respect. And, he needs to be, people like him, and this sort of, when we see it all the time, they need to be, rebutted publicly, because he's coming publicly and he's just talking publicly about his ideas. This is another thing that really kind of gets on my nerve as well. Like, you're kind of coming up with some theories. Okay, jazakallah khair. You're I'm not saying anything about your intention or anything like that. That's all in the knowledge of Allah subhanahu wa ta'ala. You're trying to see what's good, and okay, that's fine. But use it in the proper area. Use the proper discourse, proper channels to have this discussion. You're coming, as he mentions, it's a theory, right? You don't describe theories that are scientifically based theories, right, or psychologically based theories, with general public. Like, there's a discourse for that with people. That's the reason why we have peer-reviewed journals. That's why we have, medical specialists and other specialists in different areas, and live up to scrutiny. That's kind of the whole point. And I will scrutinize his remarks. I'll probably send, because his thing is quite long, and I'll send you kind of
So,
multiple
looking at his theory, I had to kind of that section I had to kind of replay it more than once, just to sort of fully grasp it. And he does describe it quite well. That there's these sort of biological needs, and then there's these instincts, and he breaks down the instincts, and they're all sort of, like, in a nutshell, that we're sort of programmed by Allah subhanahu wa ta'ala and designed in a specific way, and we have to meet our needs in a specific way, and there's limits and all this sort of stuff. And if you're within those limits, then you're okay, inshallah. And if you're basically outside of those limits, and then you're going to start struggling, and he's describing depression from within this realm. And he's sort of, I don't know how to say this, like, again, it goes back to how he first off operationalized depression. His first explanation of depression is the premise, the axiom he set up, right, in this system, is basically false. I don't know how else to put it, so therefore, everything else that comes after that is going to probably also be false. That's just how deductive logic works, right? Now, internally, it can still be valid, because if he starts with a premise and he builds on that premise, internally, it can still sort of work out. And you can see that in his discussion. It's sort of all consistent, because he's starting off with the premise that it's all about this kind of psychological based, your perceptions and your needs and all this sort of stuff. And again, as I mentioned earlier, this is all, mixing, falsehood with some truth. My biggest issue, okay, let's work with his theory, and this is what really gets onto my nerves, and really, because it really invalidates Muslims. I think at a fundamental level, like I'll start off with this sort of note. At a fundamental level, we all as Muslims accept the fact that being more religious, being more religiously committed, closer to Allah subhanahu wa ta'ala protects us. It protects us not just mentally, it protects us physically, it protects our wealth, it protects our families. Like we have this concept of barakah and protection and well-being. There's no doubt about that. Even non-Muslims who study depression and anxiety clearly show that people who are more religious they typically are more protected from depression. So that's part of that little truth that he's sort of kind of alluding to. But then to take the whole thing and build this entire theory, let's see if it lives up to this scrutiny. So if we take his theory, and he's talking about, living out, if you're not meeting these needs appropriately and these instincts and all this sort of stuff that he's talking about, then ya akhi, then all the atheists should be clinically depressed. All these atheists, all these people who commit fusuq and fujur, and people who, but that's absolutely not the case. And Allah subhanahu wa ta'ala describes the kuffar, right? He describes أُولَٰئِكَ هُمْ شَرُّ الْبَرِيَّةِ, like the mushrikeen. They're the شَرُّ الْبَرِيَّةِ. And now you're telling me that there are Muslims who they're struggling with depression. And we can say, yes, being closer to Allah subhanahu wa ta'ala can help you. But to take that and say, no, this is a cause of why you're depressed, and let's look at these causes and break it all down. But ultimately, at the end of the day, it's either related to your perception or whatever, or not following the ways or the commands of Allah subhanahu wa ta'ala in all these different aspects of life. Well, then the atheists should all be depressed. All these kuffar and these fasaq and these fajara. I mean, that's not true. Look at like let's just take an extreme example, like Donald Trump, ya akhi. Donald Trump, is a person that thrives. He doesn't just he thrives off of, immorality, the fujur and fusuq. The guy doesn't have no history of known mental health condition. Okay, sure, he's narcissistic, etc., but he actually does not have a known mental health history. So now you're coming and saying to these good brothers and sisters who are really trying to be good Muslims, they have shortcomings. Okay, yeah, we'll work on all that stuff, but they're suffering from clinical depression. And then we say to them, well, yeah, your perceptions are kind of screwed up, and you're not living your life in accordance to this. This is super invalidating, and this is to build the entire theory on that, frankly, is a transgression. I don't know how else to put it. We even have historical, let's take some examples from the Quran, okay? Even Allah subhanahu wa ta'ala describes the kuffar and describes the people that in the hereafter they will be going to the hellfire, right? Allah even describes them as being farihin, that they're happy. لا تحسبن الذين يفرحون بما أوتوا ويحبون أن يحمدوا بما لم يفعلوا فلا تحسبنهم بمفازة من النار من العذاب. So even Allah subhanahu wa ta'ala is telling us that these people that don't obey him, that break everything that he's talking about, whether it's all these instincts and these, all of those things, they're committing transgressions. They don't fear Allah subhanahu wa ta'ala in anything. They don't even they do nothing. They're atheists. They don't worship Allah subhanahu wa ta'ala. They're not depressed. They're happy. Even Allah subhanahu wa ta'ala, they're describing them as being happy in dunya. So, this is the danger. So it's such a dangerous thing to be saying and focusing on, and again, I would not be this kind of critical if he was talking in a general perspective, akhi, like he's talking in a kind of a general da'wah perspective, or, just about general things, like general, like, okay, stress, and, if you're feeling down and like you're struggling with some of your thoughts, and kind of like that self-help, the coaching, motivational stuff. Akhi, we all agree with those fundamental concepts, but to come and then take a position towards a medical diagnosis, specifically depression, and then build a theory all around it and say this is what it is, like this is a major transgression in my opinion. Wallahu alam. Um, to build on that even more, right? Um, he talks about the Muslim position, and the perspective of the Muslim and these things. Like, يعني, look at Sayyidina Yaqub alayhi salatu salam. Okay, he lost his son. Yusuf alayhi salatu salam, and all this stuff, and he got so sad and was crying to the point that he lost his vision. Okay. So now we're going to come like astaghfirullah al-azim, let's use his theory. That's astaghfirullah al-azim. That means Sayyidina Yaqub alayhi salam, he didn't have the perspective because his mourning was too excessive. Or how can we say that? How can we say that, ya akhi? Like, this is very this not only this transgresses against Muslims. There's another hadith. There's a hadith in Aisha anha where she mentions that the Prophet ﷺ, I'm just going to summarize it in English, where the Prophet ﷺ, he would make he would be fair to his wives, like in the amount of time, each night that he spends with them, and breaking breaking down like his time and his commitment to his wives. He would be fair in it, and then he would ask Allah subhanahu wa ta'ala, and لا تؤاخذني بما لا أملك. Don't hold me accountable for what I don't control. And we know Imam al-Shanqiti. Actually, I was talking to one of the mashayikh here, and he brought this. We discussed this, and he brought up the Imam al-Shanqiti, who everyone knows the place of Imam al-Shanqiti from the contemporary scholars. That this is a very clear evidence that the mental health disorders or emotional disorders, psychiatric disorders, a lot of it stems from things we don't control. Like, I know he discusses this later, like that it's okay to feel sad, it's okay to feel angry, it's okay, but you have to try to control it so it doesn't get out of control and you fall into depression. But that's the point. That's how that's part of the reason people develop depression, is they cannot control despite their best efforts. Like, and then he comes and says, well, you're not trying hard enough. Like, it's a very invalidating position. But here the Prophet ﷺ is clearly saying that I don't control all my emotions, the feelings, the love, he can't give that equally to his wives. It's an innate, subhanallah, fitra, that it's a feeling. He doesn't control that feeling. And that's kind of where a lot of mental health problems stem from. Sometimes there's these uncontrolled feelings. So that's very important to note. And again, he's kind of taking this, like, so these are some of the religious aspects. Let's go to section, or my other point, related to the actual scientific and medical, like, understanding. We're actually, like, from my perspective, even in my own training, we're actually very open and honest about this whole situation. We say we don't know what causes depression, right? While he's coming and cherry picking a specific position and clearly makes it a psychologically minded condition. That's true in some cases. It's not true in lots of other cases. Depression is a heterogeneous condition. There are different forms of it. There are different specifiers for it. It looks different in youth and adults. It's complex, ya akhi. And then we get this, how can this person come and in a 2-hour, video, and basically just kind of package it very nicely into this kind of simple, basic sort of theory, and say like, okay, yeah, this is how we should be looking and managing depression, and get rid of antidepressants. And this is not from insaf. This is not being just and dealing with this situation justly. So he does talk about it near the end, where there could be quote unquote a malfunction in the design. So he keeps alluding to this whole concept of a human being like a robot, and you're programmed and you have to fulfill these needs and requirements, and if you don't do it properly, then you get depressed. But he did allude to, yes, to be fair and honest and fair to him, that yes, I can have intrinsically I could be damaged and I have depression. Anybody says that's very, very rare. That's actually not the case. That's why it's medicalized. It's not some that's the whole point where we're trying to treat it, right? And he mentioned this many times, the Prophet ﷺ, in multiple narrations, right? It says that Allah subhanahu wa ta'ala أنزل الداء وأنزل معه الدواء علمه من علمه وجهله من جهله. That Allah subhanahu wa ta'ala brought down a disease, and he also brought down with it cure and treatment. And those who know it will know it, and those who don't know it don't know it. And that's why this is a process. It's a learning process. This is part of the secular worldly knowledge, and it grows, and people learn more and more about it. But for him to sort of come and say, well, no, this is what's causing it, and this, and just sort of pushes aside all these other, there's a lot of theories. Like he's just picking one. There's a neurobiological theory, there is like a neurochemical theory, there is a neuroelectrical theory, there is, even within the psychological, he seems to be also kind of taking a more of a cognitive behavioral therapeutic approach. We're looking at your thoughts and your perceptions and your feelings. But there's others. There's psychodynamic, there's interpersonal, there's, other sort of reasons why, people may get depressed. So short answer is, yeah, I don't know. We don't know what causes depression, but that's part of the challenge, and that's why you need to go to school for 10 plus years, so you can start treating it properly. So on that note, we don't know what causes depression. There's about 20% of cases, don't hold me like strictly to that number, but there is a significant minority of cases. It's not rare, 20% is not rare, even if it's 15 or even a quarter of cases. People develop medical depression with no known stressors. Like, it's not about loss and grief and my wife left me and I lost my business and my child died. No, they subhanAllah, they wake up one day and that's how they're feeling, and it progresses. That's why it's biological. That's why doctors treat it. It's not the other way around. And you know what? On that note too, and this also drives me up this constant concepts, with Muslims, especially living in the West, and to be frank, even how out in the Middle East as well, and Muslim countries, Muslim majority countries. This theory that like it's Western medicine that's medicalizing depression. That's absolutely not even true. When you look at the reality, like look historically, actually it was the Christians and the quote unquote Western world. They were the ones going around thinking mental disorders. A lot of it was related to witchcraft and all this sort of like possession and all this sort of stuff. And even to be fair to them as well, like I looked into this issue. There was kind of the church actually began to feel that no, this is the church actually, if you look at certain writings, say that no, this is related to like some sort of like illness. It's not like about witchcraft and all this sort of stuff. There was kind of other political reasons that this was sort of happening because of the secularization of the Western world. That's a totally side topic, but I also wanted to be fair to the Christian thought, because a lot of that is, oh yeah, they're just going around burning people to the stake and all this sort of stuff, which was happening, but a lot of it was politically driven. But when you actually look at some of the thinkers at that time, they thought it was an illness. But when you look at us and our heritage as Muslims, that started way before. That's why the very first psychiatric hospital was built in Baghdad in the 8th century, right? And you look at like our ulama, right? You look at the famous Al-Razi and Ibn Sina, right? They all classified mental illness as a disorder of the brain, yeah, and therefore it needs to be treated. Yes, there are different forms of treatment like therapy, and we'll come talk about that because he heavily focuses on that. But also other treatments, right? Medications, etc. So that's our heritage. Why is he coming now and saying like, oh, this whole medicalization and pills and all this sort of stuff? And he basically like rips all that basically apart. And then he leaves, a kind of very small disclaimer to say, yeah, except in like very, very severe cases, which are very, very rare anyways. And like, yeah, if everything doesn't work, then you can try pills. Like, yani, that's not the position he's taking. He's taking a very clear position. Otherwise, that's the message listeners would get. That's the message I got listening to him. So yeah, it's our own scholars believe that. And even in our deen, we have very, very detailed fiqhi discussions around takalluf and when is someone sane of mind and all these sort of things. And depression would fall under that because there are different forms of depression. Like again, this guy is just totally cherry picking and using this operational definition of depression that doesn't make any sense. So sorry, this is kind of a longer rant, but going on to there's melancholic depression, psychotic depression, postpartum depression, premenstrual dysphoric disorder, which is also kind of a form of a mood disorder closely related to sort of depressive illness. Depression can be caused by drugs. Depression can be caused by medical things, organic things. Depression can be caused by, like as he describes, and to be fair to him, yeah, a lot of these sort of conditions are not really depression. They're what we call adjustment disorders. People can't adjust properly to stressors, people not able to cope, or acute stress reactions, or all these sort of things. And that's sort of what he seems to be more focusing about. To be fair to him, there is a major issue when it comes within the psychiatric and mental health communities and the medical community, to be open and honest and fair to everyone, right? Like, there are lots of these concerns of overprescribing, overdiagnosing, and this stuff is well, discussed and there's a lot of discourse about this. It's not some hidden thing. I'll sort of come and talk about that. So one of the things as well, like I just forgot to mention my first section, like, so I'm kind of being critical from a kind of a Islamic religious perspective and then from the scientific kind of perspective. But back to the religious perspective, he's setting a dangerous precedent that means religiously committed, good, solid Muslims shouldn't be getting, sick with depression or all these sort of things. And if they do, then it's super, super rare. That's actually not the case. We see that all the time, especially in my practice. I see a lot of that. This sort of bridges into the sort of scientific aspect as well. Like he brings up the issue of OCD. And I don't know, he seemed to make some sort of distinction between OCD and depression. Like he's saying, OCD is the psychological disease, or I don't know if he's saying that's a disease of the mind, or I don't know exactly what he means by that, but he seems to give it a different categorization where it's like, no, that needs treatment. طيب يا أخي, who are you to say that there's a difference between OCD and depression? Depression doesn't need the same treatment. Like, why are you making that distinction? They're both psychiatric illnesses. And just like, OCD, very similar to depression,
And I'm going to get into this sort of, bear with me, kind of a lengthy explanation, because I want people to understand, really, this is how, we should be looking at mental illnesses. They are dimensional disorders and spectrum-based disorders, which means, you know, they're not, not one cookie fits everything. It's not, what's that expression, cookie cutter, one size fits all. That's not how it is. Um, the knowledge has evolved to a point of, at this time, kind of it's categorizing things. If you have these symptoms and these things, then you have depression or OCD or whatever. But there's a reason why you have to be a doctor to diagnose these things, because it is a complex process and needs assessments. Now, you know, um, moving on with that thought, um, these disorders, number one, when we look at them, and in my area, especially with children and youth, more so important, there are different dimensions to it. Not everyone who's presenting and has this checklist of like check, and fills out a rating scale and say, yeah, I'm depressed, I'm clinically depressed, and I go ahead and I do here start antidepressants, all this sort of stuff. That's not actually, I actually undiagnose lots of patients, because when you have cases that are presenting to you, you have to look at it from a multi-dimensional perspective. So one dimension, for you, let's say a patient's coming to me and let's use this example. I'm feeling depressed. I'm clinically, I'm not getting out of bed. I'm not sleeping well. I have no motivation. I want to die. I want to kill myself. All these sort of things that when we hear about them, it's like, yeah, that sounds like depression. No joy in life, severely low mood or irritable mood that's persistent every day for at least 2 weeks, most of the day. And there's criterion for it. So we have to look, okay, is this related to some sort of underlying developmental issue, right? Is this related to something, part of this person's brain development? Like, what do I mean by that? You can have conditions like chromosomal conditions, mitochondrial conditions where like brain development is impaired and puts these patients at higher risk of developing a mood disorder or depression, for example, or psychosis or whatever that's psychiatric. But it's not, it's related to an underlying issue. So, for example, we know kids who have Tourette's or ADHD, they're probably more likely to suffer from other psychiatric conditions rather than kids who don't have ADHD, or, it's kind of that risk factor that you sort of look at. That's sort of one dimension that we have to look at and really, really think about a lot, and then focus on, as he mentions, the cause, right? He keeps going back to this cause thinking. And this is how we as doctors and psychiatrists look at cause. We get the symptoms, we look at different causes. One of the causes could be related to this person's brain development in and of itself. The second, which he heavily focuses on, and this is where part of the truth is, and I have to agree with him and be honest about things and fair to him. Yeah, there are significant psychological and social causes that can bring out depressive symptoms, right? So that's kind of the difference. Clinical depression, when it's not that, oh, I have all these social problems, okay, and if my social problems go away, or whatever changes from those problems, oh, I'm just not depressed anymore. That's not clinical depression. That's why I changed lots of people's diagnoses, because that's more related to what's called an adjustment disorder with depressed features, where people can't adjust. So you see this with lots of things that are psychological and social. And he talks about a lot of these things, like bullying, abuse, loss, grief, struggling with financial issues, the dhulm that he talks about, the oppression, and all these sort of things. Those are psychological and social situations. Typically, if they improve, obviously you'll see some improvement in symptoms, but if it's a clinical depression, it's not like, oh, I'm all better all of a sudden. That typically doesn't happen unless it's a very mild case of depression. And what I see a lot of bullying and these sort of things, yeah. So, and then their third aspect is medical, psychiatric, organic.
So that falls under a lot of different things where it's just intrinsic. Like, yeah, like let's use a clear example, like schizophrenia. You know, you've developed a psychotic disorder. You may have no risk factors. You could be a perfectly healthy human being and wake up one day and believe that you're the Mahdi and that God talks to you, and you're psychotic. You're sick. Subhanallah, that's just like the ibtila of Allah subhanahu wa ta'ala. Just like your heart can get sick, your bones can break, you know, you can have lung disease, whatever, any form of disease that can afflict any organ. It can afflict your brain. Why is it any different? Why are we drawing these distinctions? Depression is the same. People can just be medically depressed. It happens. It's not uncommon. OCD, he talks about OCD. And going back to OCD, this brings me to a kind of a fourth dimension, which is other medical causes, other organic causes that are not psychiatric in and of themselves. So for example, there is very clear evidence that clearly identifies a causative relationship where certain infections can cause OCD symptoms. So it's not like, primary, what we call, or like, primary psychiatric OCD. It's a secondary kind of OCD. You see that also with depression. Like, this is what, I have to say this, he's saying to people, call me, I'm going to help you and all this stuff. Like, أخي رحم الله امرئ عرف قدر نفسه. Like, have some humbleness and self-respect. Just because you're doing some counseling work and whatever, and now you want to like treat people with depression. Actually, there's professionals who do this for a living. And you're coming up with your little theories and using people as like experiments. Like, this is absolutely unethical. For example, you could get a young person coming to you. He gives the example of like various examples. Commonly, you see it in women. Right? They come, they see their doctor, and he's describing one sitting, and then here's an antidepressant or whatever. But I don't condone that, by the way. That's actually not how you should be doing things. That's actually wrong for different reasons. I'll come talk about that. But a young person come with full-blown depressive symptoms. And actually, the reason that they're feeling this way is because they have thyroid disease. Or they can have some endocrine disruption. Or like in the case of lots of women, they develop severe mood symptoms related to their periods, right? And their hormonal cycles, right? The treatment is not typically antidepressants. It's typically other things like certain birth controls and birth control pills, etc., or oral contraceptives. So his theory when it comes to those things clearly doesn't work. Because there's medical causes. It's not just like the psychological perception, your instincts. It has nothing to do with that. Sure, maybe you can put it under his like organics, but then that's why it's left to doctors, because that's what doctors do. They study the organics of the human being. Not, with all respect to our mashayikh and stuff, and members in the community. Elders and other people, members in the community, they're basically trying to do some social counseling and basic counseling things. That's fine for the psychological, social issues, but it's a wider aspect to that. And that's why you see a psychiatrist, you get an assessment done, you get the correct blood work done, you get things done properly, and then the doctor will guide the patient. And this is what I need to talk about. And again, I mentioned this a little earlier. There are differences in practice, okay? And myself personally, I absolutely am not a pill pusher. I do not push medications unless it's absolutely necessary. And the reason for that is, in child adolescent psychiatry, a lot of antidepressants actually don't work very well. Like the studies are actually quite clear. They don't work very well in youth with mood disorders. Psychotherapeutics are actually better. So you see there's a transatlantic kind of issue where doctors typically in North America, especially the United States, they're much heavier on psychopharmacology or using medications to treat patients. And there's a lot of reasons for that. We don't need to get into that. So I do understand and can sympathize and generally agree with this whole concept of too much use and inappropriate use. But let's look at the studies, right? When you look at data coming out of the United States, the vast majority of doctors who are prescribing antidepressants are frontline primary healthcare workers, professionals like GPs and family doctors. It's not psychiatrists, but who gets the ding for it are psychiatrists, right? That's just how it is. But that's what's going on, and the reason for that is the lack of solid training. You can't see a psychiatric patient 10-15 minutes and you're here to take a pill. Like, I agree with all of those concerns. There is no doubt, and that's why people need to get good psychiatric care. But to start, that's a position of rationality. That's a position of being kind of fair and just and giving things its due right, not to take a position and cherry pick it and say, well, perceptions, instincts, and all this sort of stuff, and then what about all the other things that we talked about, and all the patients who don't get better, and all these assessments that people have to do? What, this brother is going to do these assessments? Who gave him the credibility to make these assessments and sit and talk with people about stuff? Just because he helped his, he alludes to his female relative who sounds like she was a youth or a young adult. I don't know, it's not clear, but it was a younger person. But typically, most youth, shouldn't be treated with an antidepressant in the first place, just medically. So I want to clarify that point. He's kind of painting this picture that doctors pill pushers and all this sort of stuff. And I want to also draw the comparison, like in Europe, right? They are very, very different than the United States. Even when you look at their treatment guidelines, they're way more conservative. The treatment guidelines heavily focus on, using non-pharmacology, known medications, using therapy and other things, and exercise, a lot of these other things to get people well, especially when it comes to mood disorders and depression in young people. So, we do need to talk about that. That's very important. And typically, most of the studies show that people with severe, like the moderate to severe depression, they typically need antidepressants, and they do actually quite well on it. People typically with the mild to moderate, which is what you see a lot more of because that affects obviously more people, yeah, they can do better, with other interventions. But that's also clearly listed in the Canadian treatment guidelines. Like, anyone can go Google Canadian treatment guidelines, and there's all complementary treatments, there's omega-3 treatments. It's not like, where, doctors are just trying to give people SSRIs, and maybe there are some, like, again, I'm not defending this practice. I'm saying that it's not correct. People need proper assessments. People need proper care, proper treatment, but you leave that to professionals. You do not leave that to, with all due respect to our, to other individuals or imams or whatever. They have another, just the same way I don't come out and, I start a YouTube channel and talk about, if anyone has a spiritual crisis situation, they have like, they need accounting feedback, or, they need help building a house, things I don't have expertise or experience in. Again, this is not a proper sound methodology or an appropriate course of action. So going back, like, just to summarize it, we don't know the cause of depression. There's multifactorial theories around it. We have to look at things holistically, not cherry pick a position, treat people accordingly in a personalized fashion, look at things, and we talked about medical things. Even on that note, for example, like youth irritability is highly linked with poor nutritional intake. And we're not saying like people are starving and all this sort of stuff. It could just be happening even with people who eat well. There are just some other issues, right? Like, these are things that need to be left to doctors to work on and deal with. I hope that sort of clarifies those points. This brings me to one issue that's important to clarify as well. He talks a lot about like how things may start, like, with these stressors in someone's life, loss, grief, whatever, and he has the wrong perceptions and all this sort of stuff. I agree with that as a premise, okay? And probably most psychiatrists would agree with that and say that, okay, these young people typically need therapy and treatment, or, these individuals suffering, they need some sort of interventions, a therapeutic intervention usually. But the point is those patients typically are either not there yet, as they say, they really haven't hit clinical medical depression. They'll still get the diagnosis though for other reasons, typically insurance reasons or some like drug coverage reasons or some other reasons, coding reasons, billing reasons. But the point is they get a depression diagnosis and they think, okay, I have depression, but it's something that can progress to a clinical diagnosis, or even if you have a clinical diagnosis, but it's like little mild, if you don't treat it, if you leave it, as he describes, right, it gets worse and worse and worse, and then you get depression. Okay, like let's say the moderate to severe depression, your functioning is, messed up. You can't get out of bed. You can't like enjoy anything in your life. You're not eating. You're losing weight. You can't sleep. But when you're hit there, and then he's talking about, well, let's use this psychological, get to the root of things, look at your perceptions. It's kind of too late, man. Like the harm's already done. It's just like people who, smoke. You have a lot of time, right? But once you get the lung cancer, you got the lung cancer, man. It's done. You need a serious medical intervention. So, and yeah, that's just how it is. So yeah, you can use a lot of his strategies, of the things that he's talking about to help people prevent them from getting there. And even if they're there a little mildly, yeah, we can help them. And most doctors do want people to get therapy, but there are some restrictions and waiting lists and lots of things that can inhibit people from getting the help they need. But to just kind of have these blanket statements without tafsil and getting into details, again, is not a very fair position. He mentions a few other things about SSRIs and some things. I'll send you some other kind of recordings around that. So finally, just this discussion about antidepressant medications, or typically, the SSRIs, or selective serotonin reuptake inhibitors, kind of the most common used. Just to start off with, myself personally, I'm not very big, heavy user of these sort of medications. Things have to be assessed properly, and this whole concept of pill pushing, I think pretty much any rational person, whether you're a physician or not, would sort of understand that, yeah, pill pushing is probably not a good idea. Yeah, it happens. There's no doubt about it. But again, these sort of blanket statements are not appropriate around, antidepressant use. A good example of that actually is this whole thing that, antidepressants make people suicidal and all this sort of stuff. And there's good, evidence coming out from the US showing that people that basically doctors got scared to prescribe it because of medical legal risk and not wanting their patients to kill themselves. What ended up happening is actually the risks started going up. The rates of suicide actually started creeping up during that period of time. And so then doctors went back to prescribing it. So again, blanket statements, overgeneralizations are very, very dangerous. He specifically talks about this whole numbing effect. So, Ya Akhil Kareem, just with like any other medication, there are side effects, right? This numbing effect is actually a known side effect. It does happen. I've seen it, and I've managed it with patients. So it is a real thing. What he is saying, there's some truth to it in that they either their affect is changed, which means what people around them see. They see them as kind of being like blah, dull, whatever, just they're not expressive of their emotions as much. And also intrinsically, they may feel like not as creative, or they just feel kind of dumbed down, can't feel their emotions. They want to cry, but they can't cry, stuff like that. But again, we have to put things into perspective, right? So if someone has terrible, thoughts, they have bad depression, their thoughts are, then their feelings are, that's the definition. Every day, for most of the day, you're feeling like total, and you're just feeling so terrible. You can't even describe how you're feeling, whether it's the guilt and the suffering feelings, the sadness, the emotional pain, whatever experience that person may be having.
That's all they're experiencing. So are you going to tell me as a psychiatrist, you know what, like, yeah, let's use other potential avenues to sort of treat this patient, even though their likelihood of working are, maybe prolonged or maybe not as good. And I'll come and talk a little bit about that. Versus using an antidepressant, which can within a week, typically there's more and more evidence coming out that people can get a response within a week, and start feeling better. And sure, there's a risk, whatever that percentage risk is, that they may or may not feel numb, but that's a manageable side effect. Like, people who get the numbness, you can change the medication, reduce the dose. It typically can be dose dependent. You can add another medication to it if necessary. You can use like sort of different options are available to mitigate those risks. So yes, it can happen, but it is manageable, and it's a lot better than what's happening 100% of the time for the patient, which is feeling terrible 100% of the time. And I have asked patients this. I'm like, look, we can change around or play with it or whatever, and they tell me, no, no, no. Like, I'd rather feel numb than feel the terrible depressive symptoms or the terrible anxiety or the terrible OCD, compulsive thoughts obsessive thoughts, that they get. So that's kind of the trade-off. Yeah, they're not great drugs. No one is advocating that they're great drugs or should be advocating that they're great drugs, but they're necessary, like, in some cases. And they help patients. There's no doubt. Like, this is, again, he's coming and saying, therapy and counseling and talking. If you look at the studies, right, in many of the studies looking at depression, psychotherapy and forms of therapy are typically almost equivalent to how effective medications are. Again, psychiatrists, and I can only really speak about myself and what I've been trained with, but we always advocate patients to do therapy because it teaches them skills, it teaches them how to think about things in a different way, and a lot of things that this person's mentioning. There's no doubt that I'm not knocking any of that stuff down. But just to come and say, you know what, you guys have this thing in your tool set called, antidepressants, and they're terrible, and they cause numbness, and they cause the list. Well, yeah, but there's a reason why we go to school for 10 years plus to determine who needs to get these medications and who doesn't, and all this sort of stuff. And we work with patients, and some patients want medications, some patients don't want medications. Sometimes therapy isn't available. Sometimes there's long wait lists for therapy. Sometimes people have such severe depressive thoughts that they, he talks a lot about this, opening up, you need to open up. Akhi, sometimes people can't open up, sometimes therapy doesn't work for patients. So, and therapy is different than counseling. Counseling is actually a lot less effective, like the stuff that he's talking about, and just talking to people and talking to an elder or a social, person in a social prominent position, or a imam or whatever. They don't do real psychotherapy. They're doing some forms of basic counseling, supportive therapy, maybe some forms of cognitive behavioral aspects, but it's not like formal therapy. That's done by trained people. So that's really really important to mention. And again, as I mentioned earlier, right, like, there are lots of people who misuse antidepressants. It's very easy, and we talked about the system problems, right? Like, people coming in 10-15 minute appointments, like, just pill pushing, the pharmaceutical industry. Like, no one's going to deny these things, but the thing is, to be open and frank about it, this discourse and discussion is happening a lot in the field of medicine. Like, this is not some, like, oh, we're all pro pharma, and we have no ethics, and we're just trying to pill push it, and get, like, and it talks about kickbacks and all this sort of stuff. Like, things have to be looked at in a balanced. Now, this concept of them being addictive, like, what does he mean by addictive? If he means by addictive the physiologic addiction, which means that his body got used to it and it requires, like, the medication to keep the receptor functioning at a homeostatic level, then yes, you are addicted to them. But that's the same as being addicted to blood pressure pills, or being addicted to insulin, or being addicted to anything that your body physiologically needs to maintain homeostasis. We don't refer to these other drugs as being addictive. If he means addictive as in the understanding of addiction, as in it's, a compulsive seeking behavior that causes you harm despite the, that gives you pleasure, or you feel the need to seek it despite it causing you harm or affecting your functioning, then that's absolutely not true. Because it, number one, there's no evidence to suggest that really that people compulsively seek out antidepressants. And number two, the evidence is clearly towards the former, which is that it can cause physiologic dependence, and that's why you have to have a wean-off period and all these sort of things. And people can stay off of them. Now, again, there's a lot of discussion around how long you should stay on them and all those sort of things. But the notion that, if you take these, you're going to be addicted and halas, you're done. That's not true. He needs to present some sort of evidence that it causes compulsive addictive behavior, rather than the physiologic, which is a known risk with pretty much any other medication for chronic disorders. There's another issue I wanted to comment on, where he talks about this link between taking antidepressants and becoming psychopathic, basically, because you lack empathy. Again, this is kind of one of those, I really don't know, it's this argument that clearly shows his lack of knowledge in this area. Psychopathy has very specific kind of understanding and categorization in the literature. Yes, part of it is lacking empathy, but there's other things that you need to qualify into that realm, because lots of people lack empathy for lots of different reasons. For example, narcissistic people, a lot of them lack empathy, but very, very small amount of them are actually psychopathic. They're typically not. They just have a personality disorder. There's other drugs that can actually reduce your empathy, like Tylenol. You actually go, I was just reading that, I think a little while ago, I think it was last year, acetaminophen, or different parts of the world, paracetamol. Yeah, it's linked to reducing empathy. So are they, now is everyone like this psychopathic person because, they take Tylenol at certain doses for a certain duration of time? Like, it's ludicrous. Like, it's just, as I mentioned, yes, it can reduce your empathy in certain percentage of cases, but this is manageable. Like, if this is bothering the person, you can reduce the dose, you can switch the antidepressant, you can add something to it. So there are things you can do, Yahi. I also just want to say, look, one final thing about antidepressant use. The last thing I wanted to say, Akhid Karim, is that, that most of the evidence, the good evidence, suggests that patients who have kind of like moderate to severe depression tend to do the best. He's maybe talking more about mild to moderate depressive symptoms, and they tend to do, antidepressants may not be that necessary, and they typically have their efficacy is kind of, questionable at best, and the, therapy and all this sort of stuff. But there's other things that are natural antidepressants as well, like omega-3, right? You can read that, and other complementary sort of medicines. And this is clearly listed in the Canadian treatment guidelines, for example, for depression. You can look at that and review, and people can review that. But just to come and knock down SSRIs as being like this evil drug, and they cause evil, and this is not true. Yes, there's risks to them. Yes, there's side effects to them. That's why there are people who go to school for 10 years plus to learn how to use these medications and to risk stratify and determine at what times we should or shouldn't use it. Yes, of course, there are doctors, especially in the primary care settings, and yes, it can be country specific as well. So North America tends to be a lot more drug heavy than, let's say, Europe. But that doesn't take away from the fact that these drugs have a role, and they can be very important for people, and they treat lots of conditions: anxiety, OCD, depression, They can be used to help people who have chronic pain. Like, there's lots and lots of things that these things can be very, very helpful for. And just to come and put a blank statement on it, like, that's very dangerous, right? Like, let's take chemotherapeutic drugs. They're terrible. They're like, we're literally poisoning ourselves, right? But it's necessary. The risks are very high, but cancer is a very dangerous thing. And I would argue depression is a very dangerous thing. This is inshallah the last message. Sorry for kind of the long messages. This took a while, but the his video is quite long, and I wanted to do my best to capture kind of the key areas and give this area some justice and some critical thinking. It's just kind of something to think about, especially for just to kind of take a step back. We typically don't see these same tensions between religion and medicine in other areas of medicine. Like, you don't see this tension with like cancer treatment or surgery, because to people, people see it as, oh, that's just some biological sort of issue and you just have to fix it. But we do know there's lots of social factors that aggravate them, like poverty, poor diet, poor exercise, all these sort of things. And that's heavily incorporated in medicine. But same thing with mental health, right? The major challenges, I think, with mental health is that, number one, it's way more complicated. So this person's kind of approach to oversimplifying and overgeneralizing just doesn't do this justice, and it can cause a lot of harm. As unfortunately, his approach will lead to more stigma and stereotyping and delayed treatment for people that actually need treatment, and it has serious harms to it. The other thing wanting to mention about this, sorry, I lost my train of thought for a second there. So in the other issue is Western medicine is highly secular, right? And this will cause, a lot of tension when it comes to things that involve beliefs and ideas and values and like mental health. You're dealing with your brain. The brain has emotions and feelings and these things, and it's not just like a mechanical issue, if that sort of makes sense. So even the biology of it is very complicated. Wallahu ta'ala alam, when we're trying to find the truth, we have to look at all things and try to look at them objectively and try and incorporate everything. So, from my perspective and, more, forward thinking and general and actual understandings in psychiatry, they look at the biological, psychosocial, and now the spiritual as well. Like, non-Muslims are really looking at the impact and the importance of religion and faith. And now you see that with coming specialties, kind of these sub areas of specialization, like transcultural psychiatry or culturally informed psychiatry, And as Muslims, we should be incorporating, just like we do for anything else, right? Like, why is it any different that if I go see a doctor because I have any medical problem, why can't I make dua and read, certain things from the Quran or like ruqya and take prophetic medicine and take the medicine and the care from this medical doctor, whether he's Muslim or non-Muslim? Why does it come when it comes to psychiatry and mental health? It's like, no, we have to draw a distinction. On what basis? Why do we draw that distinction? You still do ruqya and you still do these things that we believe in as Muslims. But if you need treatment, take treatment. And he's mentioned that, throughout multiple times, that this is something that's permissible and, even encouraged in Islam, that we seek out treatment. So the biopsychosocial model looks at people more holistically. The biopsychosocial spiritual model looks at people kind of holistically, like the biological issues. We talked about that. There could be biological reasons people have depression or feeling the way they're feeling. whether it's nutritional, endocrine related, hormone related, other, reasons. People, especially in older age, right? We didn't even talk about that, but seniors, a lot of people kind of presenting with dementia-like symptoms, right? They actually have depression. This is a major, major area, and we won't get into it. But my point is, there's biological things. There are obviously what he focused on, the psychological and social, and there's no doubt in that. And the spiritual, that's also part of a human being. That's in our fitrah, and he talks about that, the reverence and the need to, and we have the fitrah to worship Allah subhanahu wa ta'ala. And we combine all of that to get, inshallah, to have well-being. But to cut parts out and, to me, this, we shouldn't be doing that. That's just like, Allah subhanahu wa ta'ala, describes Bani Israel, right? He says that يُؤْمِنُونَ تُؤْمِنُونَ بِبَعْضِ الْكِتَابِ وَتَكْفُرُونَ بِبَعْضِ. They believe in part of the book and they leave part of it. We can't do that. Like, we have to look at things holistically and deal with things holistically. And I hope that's kind of my clear message. I ask Allah subhanahu wa ta'ala to give us tawfiq, and whatever is correct that I said is from Allah subhanahu wa ta'ala, and whatever I made a mistake in is from myself and the shaitan. Let me know if you have any other questions or any other comments. Again, more than happy to discuss this. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.